Welcome to the Mind Vine podcast, where we challenge the stigma associated with mental illness through conversations about a variety of issues impacting mental health. Here we bring you news, views, and interviews that intrigue, educate, and celebrate recovery. Leading us on this journey are the hosts of the Mind Vine podcast, Darryl Mathers and Chris Bovie.
So welcome to the Mind Vine podcast. My name is Darryl Mathers, and I'm with my co-host, Chris Bovie. Chris, how are you?
I'm doing okay. Were you excited about the news yesterday that you're going to be a teacher for the next school?
I am not. I understand the reason for it, but as I was saying earlier, there's 5 people in my house who are all trying to do Zoom calls around the same time. We only have limited amount of space, and I've learned that I can function in meetings on my couch, in my basement, in my garage, under my garage. So, no, it's been challenging.
I'm worried there's going to be a point. I have this bad nightmare. There's going to be a point in my kid's career where they're going to be in the workforce, and someone's going to ask them, like, "Who the heck taught you? Where did you go to school?" And they're like, "My dad." And like,
yeah. They're going to circle the birth years of these kids and say, were you part of the parent online education program of 2020 and 2021? And it might be a box in the wrong column in a job interview. It's challenging. It's challenging for our staff. It continues to be, as always throughout the pandemic. Want to acknowledge the hard work of our on-site and off-site staff who are adjusting to constant change. We're approaching a year that we've been in this pandemic. It's a year since the first case of COVID was discovered in Canada, and it's been constant change ever since. So thank you to everybody who's on-site doing things to keep our patients safe, and off-site too. It's not easy for anybody in this environment. So shout out to everybody at Ontario Shores.
Yeah, they're doing a great job. And did we get the Pfizer sponsorship for the podcast?
Yeah, I'm not sure. It'd be nice.
It hasn't come through yet.
But I think they're making they might be making some money off this. So
I was thinking about the stock market the other day. Maybe.
No. So the reason we're gathered today is to not talk about COVID specifically, which is a nice break from the rest of our lives, where it seems to dominate conversation. Is we're approaching Eating Disorders Awareness Week, and it is something that's close to our hearts at Ontario Shores. And we'd now like to welcome our special guest to the podcast. We have Joanna Anderson, who's a clinical manager on our eating disorders unit. Welcome, Joanna.
Hey, Joanna. Hi, thanks for having me.
Hey, you're welcome. And it's great to have you to talk about eating disorders, which I know is a really misinterpreted kind of illness in a lot of ways. And our program is still relatively new at Ontario Shores, but can you tell us a little bit about eating disorders at Ontario Shores and the work that you do?
Sure. So the Eating Disorders Unit here at Ontario Shores is a 12-bed residential style facility. We have adolescents that are between the ages of 12 and 18. And typically the teens that are coming to us have been through the system in terms of, more than one inpatient stay, some time maybe in an outpatient program and a day program. When that hasn't been successful in stabilizing the eating disorder, then teens would come to us at Ontario Shores for a longer stay, more intensive treatment experience.
What are some of those? Sorry, go ahead. I was going to ask you what some of those. I was going to ask some of what are those. What makes it more intensive, or what makes it so unique?
So many of the programs in an acute care facility, so let's say, Sick Kids or McMaster or CHEO are our main reference. Kids would go there when they're medically unstable, and they would stay until they've become stabilized. And they would do sort of some introductory family therapy, but really that's not a long stay, right? That's until you're medically stabilized, and then you would leave. when day treatment hasn't been successful, or it's not a high enough level of intensity, then you would come to us. And so we're able to keep kids for longer. They live here with us, right? So we have the ability to see them at every single meal, at every single snack. And we bring families onto the unit to do meal support and coaching. So when kids can eat in a hospital and then they go home and they're not able to maintain their weight or maintain, the gains that they've made, we work with the family really quite intensively to provide meal support and coaching. We also provide family therapy. So we have 3 social workers on the unit, and each family is assigned to a social worker. So they would do weekly family sessions with the parents and also with individual sessions with the teen. We have a multifamily therapy program that runs every third Saturday. All of the families come together. We've had to make it virtual for now. But we lead a group family therapy session every third Saturday. And then we have a parent group that meets every third Thursday. So it really is quite intensive, where we're providing a lot of coaching and a lot of feedback around how to feed your child, and trying to empower parents to be able to do that work at home.
I think when people think of hospitalization of any kind, there's a certain image that pops into their minds, and especially with youth, I guess. So, we're influenced by what we see in the media and the news and, in movies regarding institutions and hospitalizations. But the eating disorders unit, even Ontario Shores, which is a very progressive building, a lot of natural light, we're in a beautiful piece of property next to Lake Ontario. Even in an environment like that, the eating disorders unit is quite unique to the other units in the hospital. So can you talk about some of the physical characteristics of your unit and why it might be laid out like that?
Yeah, I know that we're very, very lucky. We feel very fortunate to have the unit that we have. So we are on the top floor of the hospital, and we have a courtyard that faces outside. And so we're able to use that courtyard to get some outside time. In the summer, the kids grow, herbs and plant flowers, and they have a little squirrel they feed out there. We have a very large kitchen that is, as you said, it's all glass all the way around. And so you're able to sort of be in the kitchen and look out into a lot of the unit. And really the design was, the thinking behind it was to be able to normalize eating, to make the kitchen the central place of the unit. So, we do all of our meals in there, we do all of our snacks in there, and people are eating, right? They're enjoying food, and they're working on getting through meals, challenging themselves around some of their beliefs and maybe their kind of fixed beliefs around what they can eat or what they can't. But it's all kind of open so that we are able to see what the kids are doing, to coach them through it, to work with families. And then on the kind of back side of the unit, we've got an open nursing station. So it's quite accessible. So when the nurses or any of the staff are back there, the teens are able to interact with us. And that's really so that we can, stay quite attuned to what's going on for them, because, challenging yourself on your beliefs or the things that are keeping you really stuck is hard. It's quite anxiety provoking. And so when the kids are struggling or they need support, we're able to kind of be right there and be attuned to what's happening for them. We also have a classroom on the unit, which is probably different than a lot of the other units. And our teacher comes every day, and we have a child and youth worker that's in the classroom with with the teens so that they can, continue to work on their schoolwork. And we want them to stay engaged in their lives, right? Because that's what an eating disorder does. It takes you out of your life. And we want the kids to be able to have something to return to build a life worth living that doesn't include an eating disorder. And so school and community and friends are a big part of their recovery.
And I'm just going to follow up on that, Chris, just before you jump in.
Sure.
Just having been on the unit, I think I described to you earlier that it kind of feels like a drop-in center at times. Like you have kids that it's very casual. You have kids on computers. You have kids on the couches. You have kids in the classroom. And one of the things that people may not realize is that our clients, our patients in the eating disorders unit come from all over the province. And eating disorder, like any other illness, is very isolating. The mental illness is very isolating, I would imagine. What is it like when you get these kids from all over the place, Ontario, and have them in the same, living quarters? Like, is there an instant bond because of their struggles, or like, what's that dynamic like?
It's hard to say sort of that it's one way all the time. I think different groups of kids will interact differently. Right now, we have a group that are all quite musical, that, we've got someone who's very talented in playing piano, one patient that's really quite talented with her voice, it's her instrument. And so over the holidays, they did a little concert for the staff and they organized it all. And so, you see different times where you've got different cohorts of kids and they'll interact differently. I think that, yes, they certainly do share a commonality in that the eating disorder has taken them out of their lives, and that they've been, often hospitalized. They're not going to their regular school. They're not seeing their friends. And so, there is a bond there in terms of being able to understand each other and understand how difficult that this has been for many of them. And I think that there is a shared understanding and sense of community. And as staff, we certainly try to foster that and have the kids support each other in terms of recovery.
So you mentioned, Darryl kind of covered where I was going to go on the provincial side of things, but you talked a little bit about this, the work that you do with the parents. So I was just curious, again, kids are coming from all over the province. As a parent, right? It's got to be really challenging to be away from your child, and especially in the pandemic in a virtual world, and maybe having less access in person. But can you describe a little bit more detail how we work with parents during this journey of recovery, and their role, and how we, what you're hearing from them about sort of information and their needs as they go through this process?
Sure, yeah. So when parents and the referral comes to us, we set up a meeting. We were using OTN and virtual communications before the pandemic because, we have people from, as you said, all over the province. So we would set up a meeting with the parents and with the patient or the child, and sometimes separate, depending on if people wanted to ask different questions or how the family felt that was going to work for them. And so we really try to work with families before they come to understand what the program is, what the expectations are, what their kind of day will look like, how to get them set up with school, all of that. And then before the pandemic, we were able to have parents come onto the unit quite frequently. And that's actually an expectation of our program if you're local and you're able to do that, so that we could work with you around meal support and have you meet with your child. And so in the beginning, we supply all of the food for our program and have the teens start to normalize their eating. But as the patients are working through the program, we would have parents start to bring food and bring the kinds of things that they would eat at home, so that we could have the kids get reintegrated into that kind of eating. So there's a lot of intensive coaching around meal support. Now what we've done is, we made MFT, multifamily therapy, virtual. And, in the beginning, as we were all learning how to use Zoom, we had some technical glitches, but really we have figured it out. So we set up our computers in the classroom with all the kids there and the staff, the parents will join. And then we're able to do breakout groups and separate the parents into one group, the siblings into one group, and then the teens into one group. And then we bring everyone back together. So we've really had, some success at very quickly redesigning that program and making it virtual. And then, parents, even with the pandemic, because they're children, we have been able to still have visitors onto the unit. So I think all in all, the pandemic certainly has been a challenge for us and for everyone, but I think that we've been able to manage it and to still work with families, to support recovery and to support the kids going back into the community and that reintegration. In one part of our program that was very unique before the pandemic was that we would take kids, we have a recreation therapist on the unit. And so we would go into the community and eat in the community, right? We would take the kids to, wherever they're going to eat with their friends that, they're going to go and have lunch or they're going to go and meet their friends. So we would take them to those kinds of places and help them practice ordering and getting the meal and working through it and figuring out what, would be appropriate for them, consistent with their meal plan. We're not able to do that right now, but we've continued to, order food or have parents bring so that we can still do some of that practice, because that's the stuff that's really tough when you leave hospital, right? To go back to the outside world and be integrated there. So it's been a challenge, but I think we've done okay.
When you talk about going, that transition outside to the outside world and practicing ordering and stuff, it just made me think the language that we choose to use when we're in those types of restaurants as adults, right? And when we're around our kids, regardless of their age, how many times we look at the menu and wonder, or how many calories that is, or, try to justify what we're ordering based on what we've eaten previously in the day, and just the kind of the outspoken thoughts that we have when we're in those situations, and how they can, do you feel like those can potentially impact, a young person who's, struggling with this type of illness?
Absolutely. The thing about eating disorders is there are certain characteristics or traits of your personality that would make you more vulnerable to an eating disorder. It's not one thing. It's certainly multifactorial, but there are traits and tendencies, and that tends to be, perfectionism and high drive for, things to be a certain way, anxiety, sort of a rigidity, right, to your thinking. And so if you're about to order a meal and your parent says that that's junk food or that's, bad, we shouldn't eat that. For someone who has very black and white concrete thinking, it's very, very difficult to understand that maybe that's food that we have sometimes, and that it's okay, right? All foods have their place and their time. So, as parents, one thing that, not that you're asking for my advice on this, but really one thing that we can do is not talk about foods in those ways, in a good or bad way, in black and white terms. We have foods that we use for fuel and we have more often, and then there's fun foods that we have maybe less often. But putting it into sort of good or bad, all or nothing terms is very, very it can be damaging if you've got a child who's going to take that and not be able to apply flexibility or adaptability or context to it.
One of the things working on Ontario Shores that I agree that we learned pretty quickly on is when it comes to stigma or resources, it's not one size. People use the term mental health. It's this general term, and you see Bell Let's Talk, and we're coming out to Bell Let's Talk. It's very general, but when you look at, for example, our forensic population or the eating disorders unit, you see that stigma is at a whole different level for this population. And I'm wondering if you take some time just to talk about what are some of the myths or things that you'd want the public to know around eating disorders that they may have misconceptions about.
I think that, you started off by saying this is a misunderstood illness. I would agree with that. I think that most people think that we have one idea of what an eating disorder is. It tends to be, anorexia, where people are emaciated and very underweight. And so there's this assumption that if you don't fit that profile, that you don't, have an eating disorder. But if you, walked onto our unit, you wouldn't be able to tell a lot of our patients from, any other kid at a high school or out in the community. The body responds in different ways to eating disorders. And so it's not something that you can ever tell with your eyes. I think the other thing is that we tend to focus on the physical manifestations of eating disorders, people's weight, their shape, the medical complications. And our patients tell us consistently that, that is only one part of the illness, and that it's actually quite alienating for them to have that always be the focus, that the behavior is psychologically meaningful. The distress that is accompanying the idea of eating and not eating is significant. And what I mean by that is, people who have an eating disorder, they tend to associate what's happening on the outside of their body with who they are as a person, their essence, their character. They can't separate the two. And so when we're focused on the outside and asking them to eat or, eat differently than they have been, they have very strong beliefs around what that means for them as a person and who they are. And I think that we don't focus enough on the internal response and the distress for patients. So that's one thing that I would really like people to understand is you cannot tell from the outside who has an eating disorder, and you really it takes some time and engagement to really understand what's going on for folks.
Sure. Just one quick follow-up on that. Do you think there's people believe that eating disorders are a product of the culture as opposed to that? Well, obviously media and culture can exacerbate the symptoms and how people respond, but do they sort of, by thinking it's cultural, sort of dismiss it as an illness? Do you feel like as a society, we kind of have that framing?
Yeah, I think you look back throughout history, we've had eating disorders, right? Freud was describing patients with eating disorders. So this has been with us for a long time. I think as clinicians and professionals, we've gone through different phases of our understanding of what contributes to an eating disorder. We do live in a culture that prioritizes and rewards thinness. We can't deny that. I think that it's multifactorial. You can't pin it on culture or the media or the way that we kind of think about it in popular culture, right? Like I'm thinking about the Kardashians and all of that. Like you can't blame it on all of that. We've had eating disorders for a long time. I think that the way we usually understand it is genetics kind of predisposes certain people to being more vulnerable to the environment. And when you've got those two things together, it can be a bit of a perfect storm. So, and when you talk to our patients, some of them will tell you that they were bullied in school, or, some stuff was going on in their family. Maybe they had a significant loss. Sometimes a comment can be misinterpreted, or, we've had kids who've lost weight because of things not related to body image. And then all of a sudden people are telling them that they look great, right? And they didn't realize that anyone was even paying attention to their body. And now that's a focus. So there's many, many reasons why. And the good thing about this is that the answer is the same, right? We have to heal our relationship with food, and we sort of normalize eating. And I think attend to the emotional distress and the emotional dysregulation that accompanies the behavior, which is the eating.
I know you don't want to blame the Kardashians, even though I think I would like to. But no, but like they're just a symptom of a bigger problem that exists certainly in social media. So, but I wonder, you're dealing with teenagers, right? And so how do you mix, positive, self thoughts, kind of the healing that you describe that goes on, when you're being treated with an eating disorder, the re-entry into the community, and then you're managing social media and Instagram, which would be I would imagine a very popular among our patients, and important for them to learn how to manage that tool if it's going to negatively impact their self-worth. So like, are those conversations that take place, or how does that get managed when somebody's being treated and prepared to, for ultimately being discharged into the community?
It's interesting that you asked me about this, because one of our patients just did a project, because as I said, we have a teacher on our unit. And so they did a big project on social media and its influence. And so, the kids were talking about the positive aspects, that they cited creativity and art, and being able to connect with other people around. We have a lot of really talented kids on the unit. And so when they're making art or music, they're putting it out there into the world. Social media gives them a way to communicate and to connect. They also talked about the Me Too movement, right? Where, people were able to talk about issues and recovery and form a community in a positive way. And then there's the flip side of it, right? I asked them when we were talking about this if they felt that social media had contributed to their eating disorder, and every one of them said yes, in some way it did. And so I think, yes, what we try to do is talk to them about anything can be used for good or, bad purposes, and educating them around the effects of being on sites that promote unhealthy behaviors and glorify eating disorders. And try to help them understand that social media is a tool, and then it really is around how you use it and how you engage, and the frame of mind that you're in when you're looking at it.
Just for add on to that point, do you think we could do a better job in literacy and at a young age and education about how to use media, how to present the authentic you, but also to understand a little bit about eating disorders at a young age. Should that be in schools more? Should we be doing more work there?
You cut out for a sec. What is around eating disorders and literacy at a younger age?
Social and even social media, teaching them what you're seeing there is not necessarily the authentic person that they're presenting. You don't have to aspire to a fake standard, but working on those self-esteem images, in school and even understanding what an eating disorder is. Do you think we need to do more in the education system?
I think so. I think when social media came around, us as parents, we didn't have a sense of the dark side of it or, how damaging some of it could be. And I think now parents are starting to understand that, limiting what their children are viewing and accessing is a really important control to put on. I think that there has been a movement within schools generally to educate kids, certainly around safety and the impact of what they're seeing. I'm certain that we could do a better job. And in terms of eating disorders, I think, while, yes, we can do more to educate kids, I don't think you want to educate kids specifically about eating disorders because the literature has shown that talking to young people around eating disorders doesn't always have the effect that you want it to. But I think that we can certainly do a lot of prevention work, and that starts with families. That starts with caregivers and parents to help them understand the food is the manifestation, and we focus a lot on the food, what's healthy, what's not, what's got sugar in it, what's not. Really what we want to focus on is helping your kids to be attuned to their hunger cues, right? Eat when you're hungry, stop when you're full, that kind of listening to your own body around food. We don't teach people that. We also don't teach kids around emotional literacy, right? How to sit with your feelings. When your feelings are hurt, when you're sad, when you're anxious, when you're scared and you don't know why, what do we do with that, right? Like, we don't really teach kids that part. And so when you have all of those feelings, and the literature shows us that people with eating disorders, we call them hyperfeelers. They have big feelings and they feel things deeply. And so when you've got all these feelings, you don't know what to do with them. And then you can control your food, your intake, right? And that makes you feel like you've got some control. That can be a really, damaging and dangerous combination for children. So I think media literacy for sure, but I think we need emotional literacy as well, and to help parents know how to talk to their kids about some of those things. And that's one of the things that we do on our unit. We use a therapy called EFFT, emotion-focused family therapy. And it really does teach parents to be able to validate, listen, attune, deal with those big feelings. Because, if your kid is a hyperfeeler or has high expressed emotion, that can be really challenging to cope with if you're not equipped yourself. So I think there's lots of room for us to improve and educate, parents, our patients, community, ourselves. Yeah.
Well, I mentioned off the top, it's Eating Disorders Awareness Week. And I think about all the different groups in a kind of Ontario Shores sphere that are stigmatized, right? I would say eating disorders is certainly among them, but certainly males who have an eating disorder would be stigmatized even further. And can you talk a little bit about, because I think it's universally known as a girl's disease, any type of eating disorders, but that's not true. And it's not what we see necessarily on in our treatment program.
The stigma really does contribute to poor outcomes for males in eating disorders, because what we see is that when males present, when they come to attention by care providers, they've been sick for longer, and they, their weights and their health outcomes are poorer. So in the eating disorder community, we have done a lot of work to educate and to reach out to males and to try to erase that idea that this is a female illness. It's difficult, right, to break that down, and it has to happen over time and through large scale education campaigns. NEDIC is the National Eating Disorder Information Center. They have done a lot of work to bring attention to males and eating disorders, and to really try to educate care providers to look out for boys, right? And to notice the signs and symptoms. And early intervention is one of the strongest tools that we have in our toolbox to be able to, help kids get the attention that they need sooner. So I'm glad that you brought it up, because we've had a number of boys on our unit at Ontario Shores, and it's difficult. It's difficult for them.
So you talked just quickly on early intervention. So as parents, what kind of cues or things should they be looking out for? And any tips, just kind of, if I see my child, maybe I need to do a little bit more focused thinking and understand what's going on.
Well, we always tell parents, you know your child better than anyone else, right? You know the normal patterns. You know the way that your child has eaten throughout their life. And so if you're starting to see changes, I would pay attention to that. I mean, often we see, kids aren't going to school right now, but lunch bags coming home, with half-eaten lunches or not at all. Or, teachers will often notice, right? The kids aren't having their snacks or their lunches at school in the same way. I think if you're noticing heightened anxiety in your child around food or the way that they look, that would be something to pay attention to as well. And, the kids who really have those kind of, like I said, we call them hyper feelers, those big feelings or anxiety, that is a predisposing factor, right? And so when anxiety isn't treated, people find ways to cope with their anxiety, right? Whether it's food, substances, so I think if you have a child that you can tell is very, very anxious or is really struggling, getting some help early for that to help them cope with and manage those emotions is very important. And then certainly if you're, seeing that your child's not growing or progressing, or, your physician can help you kind of look at those targets and see where your kids should be.
One thing I wondered about as it pertains to eating disorders is stories. So we have a lot of advocates developing in the mental health area who are sharing their story in a lot of ways, in a lot of instances, not necessarily that long into their recovery, that part of their recovery is actually sharing their experience. But with eating disorders, it seems, at least, from what, you gather on in the media, that people who have been through an eating disorder in their youth don't tend to disclose publicly or feel comfortable sharing until they're much older and maybe established. And I wonder if you feel like, would it be more impactful to young people to have some voices out there that are closer to their age, or do stories of recovery and eating disorders, do they have the kind of impact that we normally associate with mental health stories?
It's a good question, because we often have, patients asking us for someone who's recovered to come and talk to them, or, families really, really appreciate having someone who's recovered coming back to share the story. So I do think it's deeply impactful, and it also instills hope, right? And hope that things can be different is such an important part of anyone's mental health, journey. I think that when you've had an eating disorder, it's, if you, let's say you have a struggle with alcohol or with substances, and you stop using and you enter the recovery community, right? That is something that you can be abstinent from, or you can make that a choice, right? A lifestyle choice, to not use those substances or to be part of a recovery community. Eating disorders tends to be a different trajectory, where you have to heal your relationship with food, and we eat 3 times a day, usually 3 meals and snacks during the day, right? And food is such a big part of our lives and our culture. We celebrate with it, we mourn with it, right? And so it's a longer journey. And it's something that you have to manage on a day-to-day basis. And so I think it doesn't tend to be something where people are like, okay, I'm done now. I'm recovered. I'm fully good. Great. Tick the box. Does that make sense? Like, yeah. I think it tends to be a work that is ongoing and that you're working through. Does that mean that you can't be part of a recovery community and put your story out there? No, it doesn't. But I do think that there's still a lot of stigma. And I think a lot of people feel that because they're working towards recovery, or they're managing on an ongoing way, that it tends to be different. But and this is all very recent, right? I think that even people wanting to get their story out there at all is more recent in eating disorders. I think it was heavily stigmatized for a long time. It still is, not to the degree that it previous, but we're still not there yet, where people feel that they can be open and talk about it in a way where they're still managing it and still in the process of recovery.
Mm-hmm. Well, hopefully this is the start too for us talking about eating disorders at Ontario Shores, because we haven't done that for a lot of reasons. In the short existence of our eating disorders program, we haven't shared a lot of stories. We haven't talked a lot about it. So hopefully this is the start of that. And thank you for taking the time to join us today. It was really enlightening in a lot of ways. And I think obviously timely with the Eating Disorders Awareness Week, and people, especially young parents of young people, might find it very helpful, just some of the points you made. So thank you very much for joining us.
Thank you.
I hope we can continue to talk, and happy to answer any questions that come out of the podcast or that people have.
Great. Thank you.
Thanks very much.